As we age, we want to look as young as we feel, and today we're going to find out how. Dr. Jason Swerdloff from Bay Dermatology and Cosmetic Surgery is here to tell us how you can look like yourself, just a bit younger. Welcome, Dr. Swerdloff. Good to have you here.
Thanks for having me.
So let's talk about this natural lift approach. How is this different from a traditional facelift?
Well, the main difference is the natural lift is done in my office. It's done with a different type of anesthesia. It's done without general anesthesia or intravenous sedation. So it's done with a sleeping pill and local anesthesia. So patients are typically nice and relaxed and comfortable for the numbing and the procedure.
And where are you lifting? What are you doing?
Well, it addresses primarily aging changes in the neck and the jawline. Those are the areas that most of us see as we get older, and so it really does a great job of improving aging changes in those areas, really the lower third of the face and the neck.
And what's it like after the procedure is done? How quickly can people get back to regular life? Yeah,
typically people, there's the physical part of the recovery, when could you go jogging again, that kind of thing, and that's usually about a week. In terms of when you look good with some makeup on, it's usually the same, about a week to 10 days. If we combine it with other procedures that we do at the same time, maybe a little bit longer, 10 to 14 days.
I'm curious to know, who's a good candidate for something like this?
Well, really anybody who's concerned about aging changes, in the areas that these procedures address. It's really better to start when you're younger. It looks more natural and you get the benefit of the procedure. These procedures last forever, and that you always look younger than if you hadn't had them done, right? So if you start younger, then you have a longer lifespan to enjoy, looking your best.
Well, while you're getting the natural lift done, are there other procedures that can be done at the same time?
Absolutely. We can address basically all manner of facial aging problems. So we can address problems with the eyelids. Upper and lower eyelid surgery can be done at the same time. We can do brow lifting at the same time. We can do facial fat grafting at the same time to fill in areas where we've lost some volume in the face. Right. We also can do resurfacing of the skin to help with lines and wrinkles and brown spots and so forth. So all of these can be done, in the comfort of my office without having to undergo deeper levels of anesthesia, which is safer, and it's what most patients prefer nowadays.
Well, that's a lot of work, and I'm thinking about, gee, not going totally under for all of that?
Correct.
So are you, could I be talking to you while this is going on?
Yes, and that happens a lot, although in most cases people don't remember. The medicines that we give people, sleeping pill, have kind of an amnestic effect, so people don't usually remember, but yeah, many times we're having good conversations. And I learn a lot from my patients. I try to find out more about them during that time, but it's more fun for me, so I learn about the kind of jobs that they do or did and their families, and it's a good time.
Good way to get to know somebody,
Absolutely.
Huh? So really, I mean, as far as you're going to have a little bit of downtime. You can't just jump in the car and go. Correct.
Yes. I mean, if you want a significant change, there's going to have to be some downtime. There's some things that we can do, Botox and fillers that are very quick. You can do it, on your lunch break and go back to work. But, procedures that get more improvement, there's going to be a little bit more downtime. But it's pretty reasonable. If you can, have the procedure done towards the end of the week and take that next week off of work, almost everybody can be back with makeup on the following week.
And for anybody who fears they won't look like themselves, because I think ultimately people still want to look like them. They don't want it to be obvious.
Absolutely. It's a question I get all the time. And the key is, people absolutely have to look natural. The goal is to get as much improvement as we can, but to make sure patients look natural, and that's what I'm an expert at doing.
Good stuff. Thank you very much.
My pleasure. Thanks for having me.
For more information, head to drjasonswerdloff.com or give Bay Dermatology a call at 727-781-7080. Thanks again.
My pleasure.
We'll be right back.